So, welcome. You have found your way to the Comprehensive Prevention Planning CPP Consultant Technical Assistance session. I want to give you just a few notes before we get started, and then we have some incredible content for you. Few quick notes. This presentation is being recorded. A follow-up email will be sent to all participants within 3 days of this webinar. That email is sent to your registration email, however you registered for this event. It'll include some things like copy to this slide, links to resources that were discussed, and a feedback survey in case you miss it at the end of today's session. Another note to make, during today's session, you're going to have an opportunity to interact with the presenters. Mostly dropping comments or questions into the chat will be the best way to do that. But you can also raise your hand in your toolbar at the bottom of your screen whenever we open for Q&A if you were looking to speak directly with presenters. Speaking of which, we do have some note-taking slides that you'll find in the chat now. If you click that link, it'll take you to a PDF document if you would like a copy of today's slides. But first, I want to talk to you a little bit about today's presenters. Today, you're going to hear from presenters that represent CDSS, CWDA, and Casey Family Programs. Let me start by introducing the staff representing CDSS, and I'm going to begin with Cheryl Treadwell. Cheryl Treadwell is the branch chief of the Safety, Prevention, and Early Intervention branch at CDSS. Cheryl is responsible for the oversight and development of programs and policies that impact the front end of child welfare system. Cheryl's experience in the human services field spans over 20 plus years of policy development impacting children and families. It is her team that has the primary responsibility for the implementation of Part 1 of the Family First Prevention Services Act. We also have with us Kelly Winston, who is the chief of the CDSS Family Centered Safety and Support Bureau. Kelly has worked in the Child and Family Services Division of CDSS since 2009, overseeing policy implementation to address the needs of trafficked youth and families at risk of entering the foster care system. Kelly also has 20 years of experience as a child welfare worker and clinician, contributing to her passion for supporting programs that aim to preserve and support families. Lastly, representing CDSS, we have Hillary Conrad, who is the Bureau Chief of the Office of Child Abuse Prevention at CDSS. Hillary joined the department in 2015 as an analyst working in the Prevention Network Development Unit. Prior to state service, she was providing direct services to families as a child welfare caseworker and worked for nonprofits and private entities in the human services industry. She is passionate about providing technical assistance to build a more integrated and collaborative prevention continuum of care. And next, I'd like to introduce two awesome individuals who will be facilitating today's conversation. We'll start with Barrett Johnson, who is a consultant of County Welfare Directors Association. Barrett, or Barry Johnson, is licensed clinical social worker with over 25 years of experience in a variety of clinical and leadership positions in child welfare, trauma, law, and technology. He is currently a consultant and psychotherapist based in San Francisco. He works with the County Welfare Directors Association to assist counties in child maltreatment prevention. We also have Dana Blackwell, Senior Director of Casey Family Programs. Dana serves as a Senior Director of California Strategic Consultation at Casey Family Programs. In this role, Dana is responsible for leading CFP's work in the state of California to include statewide programs, initiatives, and systems improvement activities. With that, I'm going to turn it over to our first facilitator, Dana Blackwell, for a review of today's agenda. Dana?
Thanks, Jessica. Welcome, everybody. We're glad to have you here. Today's meeting really is to engage with you all in understanding the progress of the development of CPPs in the counties where you're providing technical assistance, and also for CDSS to provide you with updates, explanations, and just to have a conversation about how it's going as we get closer to the deadline for submission of your plans. So as you can see, CDSS will be giving you updates. We want to understand, what successes and what challenges you're having, and then do some level setting and Q&A around several topic areas. Finally, we want to get some feedback on the many resources that have been provided to you and the counties in the development of your CPP, and then we'll go for closing remarks. So that is our day today. Thank you again for joining us. Next slide. So I'm first going to turn it over to Cheryl Treadwell to give some updates from CDSS.
Good afternoon, everyone. Just happy to have this session with you. And I just want you to remember this is a dialogue and we don't want it to be just a unilateral stand and deliver presentation to you. So let me give you some updates to where we are right now. Our 5-year plan, it is intended to be submitted. It's going through the internal review process at this moment. So it is our hope that we'll have it submitted real soon, hopefully in the next couple of weeks. We're very hopeful about approval with this round, given our latest conversations with ACF. As you know, we've released a number of items. We've had our assurances template, which is required to be submitted with your plan. And then we have the comprehensive prevention plan review tool, which sort of tells you what we will be looking for in terms of how we're reviewing the plan. Just want to manage some of your fears out there. This tool is not like a report card, but more or less a checklist of making sure that you have the key components that are in your plan for us to read. And as you know, we've hosted a numerous amount of webinars and trainings over the last several months. As you can see, we had a learning series that we put on. It was, I don't know about you, I thought it was very good. There were some very good topics there that I hope that you were able to take advantage of. The evidence-based service-informed delivery models, there was some training there. And upcoming is more around tribal engagement. We want to make sure that we get some good resources and subject matter expertise advice in that next webinar. And then we have our statewide prevention convening coming up in May. We've been working diligently on that with a cross sector of stakeholders across the state. So really hoping that convening you will take advantage of. There's more information to be found there. And just, of course, the reminder, the plans are due July 31st. So if there are any questions, don't hesitate to ask us about those timeframes and take advantage of this information. I'll transition it back to you, Dana, and then you can begin the session. And just to remind folks, we want this to be a dialogue as well, and not us just stand and delivering. A lot of the information that we have here is in written material, but we're really interested in you sharing with us what you need from us and what you feel your counties need better understanding for. All right, Dana.
Oh, unmute your mic, please, Dana. Thank you.
Thanks. So to get the dialogue started, we thought we would start learning a little bit from you about what's working in the development of your CPP and what some of the challenges are. So we are going to drop a link. Next slide, please. We're going to drop a link into the chat for a Mentimeter. And what we'd like you to do is put a couple of words into the Mentimeter once you click on the link that talk about what success you and your counties are having in the development of your CPP. Is the link in the chat?
The link is in the chat, and it looks like responses are starting to roll in.
Great. Collaboration. Collaboration is really rising to the top. Creativity. I haven't heard creativity before. I like that. Engagement. Shifting mindset. Critical thinking. All right. So two words that I wonder about. First is collaboration. What does collaboration mean to you all? And then the shifting mindset. So the person who said shifting mindset, do you mind coming off mute to share what you mean by that?
Hi, Dana. Hi, everyone.
Hi, Kush.
Hi. Um, while it's not fast, I can see a slow appreciation meeting after meeting with counties and the county teams to start to wonder about social determinants of health and wonder about accountability for community health, and just the bells are going off more than it used to. It's not like we're there, and it is slow, but I kind of like that it's slow, because that's a sign to me, kind of like a diet that's actually going to work, right? That the transformation is happening, and it's happening in a sustainable way, rather than somebody coming in, telling them what to think. They'll think it for a little while, write it down in a plan, and then we'll be done with it.
Yeah, I appreciate that, because it does. I mean, when you're talking, Kush, I'm also looking at words like critical thinking, right? Cross-sector collaboration, changes, creativity, and that's part of that mindset shift that we need for sustainable change. Thank you.
Welcome.
Anybody else that wants to just give us a peek inside to the success that you're having with your county partners?
This is Lucy with Strategies, and for us, it's definitely community engagement. We have in Lake County, we have a combination of partners that are non-traditional to the Child Abuse Prevention Councils and are now participating in the CPP process. So we have partnerships that were at one time maybe challenging, or the relationships were not there, that are actually now proceeding and being part of the process. But we also we held a community engagement forum on February 21st, and we had a attended community meeting by parents and providers, and they basically worked together side by side to develop target populations, to identify priorities. And it was a moment of reflection where a lot of the parents didn't really see these providers as someone that's on the other side, but it was somebody that is actually side by side working with me, because they themselves also live in this community. So that was a huge, I think, reflection point. And we had a 3-hour session, and we ended our meeting with a community dinner where you had mental health providers sitting next to a grandfather that's raising his grandchild, and it really allowed for conversations that we typically don't see. So this CPP process has really helped us break some of the traditional approaches to planning.
Thank you, Lucy. That is really impressive. And it's a heartening story, because we know that as we work to reorient our approach to supporting children and families, that this sort of integration and engagement of all of the people that we hope to support need to be at the table. We need to hear from them. And that's part of sustainable change. It's part of the mindset shift. And it sounds like you're doing a fantastic job. So thank you for sharing. I see Cindy Sutcliffe with her hand raised.
Yes, you do. I just wanted to build off what Kush was saying. We've been working on creating a child abuse prevention plan since 2018 in Humboldt County through CAPC. And the focus has always been on the social determinants of health, which always seemed kind of odd to a lot of the folks at the table. But after talking about it and talking about it and talking about it, everybody's on board, and it's very integrated into the comprehensive prevention plan. And it also did a really nice job of being able, allowing us to be able to expand the composition of the cross-system collaborative to meet those social determinants of health. So we have, like the mortgage lender from Coast Central Credit Union. And we've got a guy, well, I don't know exactly what his position is with Redwood Coast Energy Authority, because they're the portal to the low-cost PG&E energy program here up in Northern California. And so we got these, I would not call them the usual suspects, sitting at the table, and they're all very engaged around our goal of, providing essential services, primary and secondary services that addressed all 5 of the social determinants of health in order to be able to keep families out of child welfare and kids out of foster care. It really all links together, but it's kind of, it's exciting anyway.
Yeah, they have an investment in the community. That's what I hear, right? That the community and wellness for the community is beneficial to everybody. So that's really great to hear. Thank you for that, Cindy, Lucy, and Kush. So now we're going to drop another link into the chat. And we want to understand, next slide, we want to understand what challenges you're having, you're currently facing in the CPP planning process. So just a couple of words that describe the challenges that you all are facing in developing the CPP plan with your partners, your county partners. Staffing. Paying lived expertise, tribal engagement. I'm going to give it one more minute. I'm starting to see the other side of the coin of the story that Lucy and Cindy talked about. EBPs in rural areas, vision to development, Latino outreach. So I'm going to ask somebody to come off mute who contributed to tribal engagement, really standing out as one of the challenges. Anybody want to talk about the challenge they're having with tribal engagement? Because they're critical, right? Lucy? Thanks.
I will share. We're having in Lake County, obviously, it's really about relationships and nurturing relationships, as we've heard. With our tribal partners, it's about having cultural humility and being able to reach out to learn about what are the needs of our tribal partners, instead of asking them just to show up to a meeting. It's really about taking a step back and realizing that we don't want just our tribal partners to feel like they're part of this plan because there's a deadline, but it's about authentically caring about building a relationship. So that is one of the challenges that we've had in Lake County, which has been a focus. But the Latino outreach is one that I think is critical, because we don't have bilingual sessions. There isn't forums that are in Spanish. So in my case, obviously I'm Latino, so I'm able to provide that for our county, but I don't see that in other counties. And so what we've done is we've also partnered with our Spanish speaking parents in parenting classes, and we have held focus groups in the parenting classes to hear about their priorities and what are some of the things in the culture that we need to be aware of for cultural sensitivity, and also so that the staff in the county can learn, and there's an opportunity to obviously engage. So for us, what I've seen and I've advocated is for Spanish forums, Latino outreach, and having Spanish focus groups so that we can hear from our Latino parents, residents. And then for our tribal partners, we actually had child welfare go to our tribal partners' offices, break bread, and actually sit down. And it's not about just asking them to come to a CPP planning meeting, but it's about just trying to, learn about what are some of the challenges. Where can there be possibilities to partner, not just us asking, please, we need you, but instead, like, how can we be here for you? And so it's really a shift. And that is a conversation we had during one of our CPP sessions, is about the culture of humility in our end that needs to happen, so that we are learning and we're listening instead of asking. So those are two reflection points for Lake County.
Yeah, I think what part of what I hear you saying, Lucy, is the recognition of the engagement and really trying to find alternatives to authentic engagement, right? To make sure that your community members can participate in finding ways for them to be heard in non-traditional ways. So that's great. Thank you. Let's see, there was somebody put in the chat, I'm trying to see it now, vision to development. If somebody could come off mute and talk a little bit about that.
Hi, this is Jim Paulson.
Hi,
I'm
Jim.
working with Contra Costa County, so I put it in there, so I'll speak up.
Thanks. Great.
So it really, I'm looking at the other entry that says details of implementation, and that's just a rewording, I think, of what I was indicating, that I think there's really been some really wonderful collaboration and work on developing, as was mentioned before, kind of outcome measures about healthy communities and really bolstering of relationships, some that were there already and that have improved and been enhanced, and some new relationships that have definitely developed that will continue on, kind of regardless of their connection to CPP. I think that's happened, but it's now getting down to kind of some of the more nitty-gritty things and some of the details that need to be included in our CPP to then be submitted. And so that's kind of been a challenge. And also, kind of waiting to hear back from the state too, and about their own submission too, and just kind of doing what we can to continue to press forward, but also, anticipating that there could be some helpful feedback once the state hears back as well from the feds. So,
yeah. So Jim, let me ask you a question. So, it's getting down to sort of the brass tacks and making decisions about implementation plans and perhaps choosing target populations or EBPs. Can you talk to us about the governance structure and how that is either helping you or to make those decisions? How are you using sort of cross-sector collaboration in making decisions?
Well, and I'm kind of new to the scene here too.
Yeah.
There's been really effective communication. We tend to be able to communicate to, the leadership, and there's a couple of there's a senior kind of leadership committee, and then a very large CPP group here in Contra Costa County. And that information flows pretty quickly and pretty smoothly and effectively as far as getting feedback. One of the things that we're actually developing as part of our CPP has some conversation is data sharing, data and measurements, and also even the kind of the economics and fiscal realities of a project like this, and as it trickles down even to whatever CBOs and community partners and those with lived experience, how to have those kind of conversations as well and get that feedback going back and forth. So I think we're getting into the next phase of how to provide more details around those areas. And I'll say just overall, kind of coming up fiscal plans and financially, what's this going to look like, as that's kind of the next step, that the kind of the inner team here, the small team that I work primarily with, Children and Family Services, are really talking about how do we have those conversations and get that feedback and do a good job of that in time to make the submission deadline.
Yeah. Can I ask you, so as we go along, we're going to be trying to look at solutions. And so I would invite you, when we get to the place of what do you need, how can we be, or how can the state be more helpful to you, that you, if you have solution or ideas around what you need on those areas, that would be great for you to share with us and to ask us and put into the chat.
Well, can I, now that you have me, I'll throw one thing out there.
Okay.
You know, there's a conversation in my county about kind of establishing our own deadline to get something to the state kind of as essentially as quick as possible. And does that make sense to then get some feedback, you know, even if we understand that there might be some challenges there, but there's kind of been that conversation as well, is you know, how much, you know, time and energy and effort do we put into trying to really have as much of a polished submission as possible. Of course, that's our goal, but
Right.
we also kind of thinking, you know, would there be some advantage, or would it be ultimately more helpful in having us, if we submit something that we might get, you know, we might get some feedback on, and then could still do some tweaking to prior to the final submission date.
Okay. Troy, I see your hand, but I do want to open it up to Cheryl, Kelly, and Hillary. What about this sort of rolling, you know, being able to submit to get a response so that they can refine based on your feedback?
I'll jump in first and then the team can add. I think we would be open to that. I mean, I think there's an advantage to having that conversation and providing feedback given the time. So yeah, I think that we would be open to having that conversation. It can only help us and also you too as well to, you know, get an indication if you're in the right direction or not. But also, you know, with your comments in terms of, I don't want people to, we want good plans,
Right.
but we also don't want to be so hard knocked on that we're not able to engage in a conversation with you about it. So I think that is something for us to be open to. I don't know if the team wants to add anything.
I think I would just say that, you know, I guess our thought would be, why wait, right? So if there's anything that you think that you want to run past us to get feedback on, now would be a good time to do that. We know that we're going to get plans upcoming here in the next, hopefully, weeks, if not months. And so, you know, want to help you get information as quickly as possible. So when we do hit that deadline, you're not kind of coming up right up against it. I mean, having said that, I mean, the state is able to provide some technical assistance. We've set up processes for that. And, you know, they're available now if you want them.
Great. Thank you, Kelly and Cheryl. And we'll be reviewing some of those resources towards the end of today's meeting. Troy.
Just really quickly, Troy Nichols here from Strategies TA, and I just wanted to piggyback on Jim's comments. Thank you, Jim. That was a very good depiction of the things that are going on. Wanted to go back a little historically over the governance piece. I really saw a real shift in Contra Costa when AB 2083 combined with the prevention planning team that was developed through CWS and Strategies. And when we made that combination, the governance, the communication lines, things really started to change, improve, and start to add to the process.
Thanks, Troy. Would anybody else like to come off mute to just share their experience? You know, paying lived expertise, I think, is a challenge that we're all facing, especially as we really recognize and value their input into anything that is being developed. Nothing with them, without them. About them, with them, without them. About them, without them. I don't know. Anybody else? Okay.
I can just share in El Dorado
Thanks, Barb.
County. We did use some of the funding to pay people to come to listening sessions. And we gave $100 Safeway gift cards, and it was extremely successful. We also had Spanish language interpreters at the sites. and we used the libraries, which are community hubs, and it worked really, really well. People came for 2 hours on a Saturday morning or after work. So to give somebody a $100 gift card does not seem extreme at all. And it was excellent feedback, and then shared with the prevention planning team, and people were just so excited about it, and now are really want to keep that momentum going. I think 90+% of the people that participated want to continue to participate. So it's just gave us a wealth of human beings that want to be a part of this process. So it worked really well for us.
That's great, Barb. Thanks for sharing those strategies. Cindy?
Yeah, I just wanted to piggyback on and on the tribal engagement piece. In our county, we have a lot of tribes, and they have a tribal social services directors meeting every month. I don't know if other counties have this, but I finagled an invitation to it and just talked about what we were trying to do with FFPSA and FFPS, and was able to get several tribes to just say, yeah, we're in, count us in, because the goal was so much in line with what they wanted, which was keeping families out of child welfare and kids out of foster care, because we have a disproportionate number of kids in foster care. The other thing I wanted to say was we used our American Recovery Plan Act community-based child abuse prevention dollars to issue gift cards to participants in the focus groups that we had over the summer. This included, we had 3 focus groups that were strictly Spanish speaking. We had 3 focus groups that were strictly tribal, and it was an easy do with that particular pot of money. And it definitely, I think, enhanced our focus group participation by being able to provide the gift cards. We wound up with over 160 respondents, participants, over 19 focus groups scattered throughout the county. So it worked.
Fantastic.
And then we're fortunate too, I'm sorry. We're fortunate too that we actually have parent partners that are employees of children's behavioral health, and they've been at the table since 2019 when CAPSI was driving the boat around the creation of a child abuse prevention plan. And I arranged to make sure that they could be part of our cross-system collaborative. And we're still trying to figure out a sustainable way to pay parent partners from all the 20 sites that we have that make up our community pathway. But once I get that figured out, I'll let you know.
Please do. Thank you to each of you for sharing your experiences. And with that, I'm going to pass it to Barry.
Thanks, Dana. And good afternoon, everybody. That was a great conversation. Lots of really interesting and compelling strengths, and also some real challenges and some common challenges that folks are having. So it's great to see that. We hope to address some of that. We also hope to address some of the questions that you asked in registration. Some of you asked some great questions, and we want to do that partially through this next segment of the presentation. It's sort of a level setting and question and answer. So now's your chance to get ready in different areas to ask your questions, either in the chat or raise your hand. We'll stop periodically. Dana and I will stop the conversation periodically and give you an opportunity to ask questions of CDSS, ask for any clarifications. Just so you know where we're going to talk about the components of the CPP, including the assurances and the template. We're going to talk about tribal and community engagement. We're going to talk about the target population and selecting your target population. We're going to talk about the state block grant expenditures, which is hard for me to say, so I'm hoping to be able to keep that out of my mouth. And also the payer of last resort a little bit, and a little bit about the review tool that we use to assess the proposals by CDSS, review the proposals by CDSS. So Hillary Conrad of OCAP, Office of Child Abuse Prevention, is going to kick this off, and she's going to talk to you a little bit about review of the components of the CPP, the template, and the assurances. So take it away, Hillary.
Thanks, Barry. Good afternoon. Happy to be here with all of you. And as Barry mentioned, I'm just going to provide a high-level overview of the required components of the Comprehensive Prevention Plan, which some of this information may be very familiar. You can go ahead and move to the next slide. As a requirement for the Family First Prevention Services Program, counties are required, and what we're wanting to see is that you're going to develop a 3-year plan and submit the plan. You'll hear this several times by July 31st. The idea of this plan is really to create that child and family well-being continuum that increases access to services prior to child welfare involvement and keep children in their homes. And we really want you to be thinking about how to address disproportionality within the child welfare system, making sure that you are engaging with the community, so there are community-driven needs when you're identifying the services and the target populations to serve. And of course, we want you to be doing all of this through an equity lens. So what needs to be included in this plan? This plan needs to include primary, secondary, and tertiary intervention strategies. It needs to include prevention services that are serving those priority target populations that you identify. So making sure that the services are addressing the needs of those populations. And then I just want to highlight, and Cheryl or Kelly is going to talk about this later, but it's really important that you're engaging your tribes and those with lived expertise in the development from the beginning and all the way through the implementation of your comprehensive prevention plan. So I'm going to just provide a little bit of a description for each of these required components. All of this information can be found in the All County Letter 2223, which I believe is on a list somewhere or is going to get dropped in the chat. So first of all, the asset mapping and needs assessment. This is all the information that you've gathered to make your decisions about which services you're going to put in the plan, as well as who you're going to serve. It's a description of the outcomes of all that data gathering, information gathering, conversations with community members, those listening sessions, in order to develop as a result of your asset mapping and needs assessment. It may also include any capacity and readiness assessments that were completed or the implementation guide. So making sure that you just bring all that information together and basically explain to us what you learned from that gathering process and making decisions, how you use that information to make decisions about what went into the plan. Kelly's going to talk about this a little bit later as well, but another required component is really about the target population and the services. And this is a description and a rationale for the selection of your target populations, and then also your candidacy populations to be prioritized and the services to be included in the plan. So why were the target populations selected? And then why were those particular services selected to address their needs? Another required component is the theory of change or the logic model. And this is describing the activities and intended outcomes for children, youth, parents, caregivers, and families. It's basically documenting that thought process that shows that your goals are linked to your activities and to your intended outcomes. Another required component, and you'll hear this several times throughout today's session, is cross-sector collaboration and stakeholder engagement. And this is a description of how agencies will ensure that, making sure that you have all those required partners that are listed within the ACL 2223, and making sure that you're not only including them in the beginning, but you're also including them through the development of plan, the implementing of the plan, and then that continuous quality improvement process. Another required component is the governance structure, and that's a description of the county's how they're going to ensure that required cross-sector collaboration is utilized in decision-making for the comprehensive prevention plan. So how did the governance structure participate in the development, review, and approval process of the plan? Another required component is also the integrated core practice model. And this is just making sure that you're incorporating those integrated core practice model principles into the strategies of the plan. And finally, we have the spending and sustainability plan. And this is describing how the state block grant will be used for prevention activities and services, and the extent to which additional funds are leveraged for your comprehensive plan. The spending plan is required. However, the template that we have provided is not. Next slide, please. So on this slide, we're just listing what is within the assurances template. And this template is required and is to be signed by child welfare and probation. And it covers the area that the state will be rolling out guidance to ensure that we're going to meet federal and state requirements. So this template must be completed and submitted with your comprehensive prevention plan. The components of the assurance template are as follows: your Title 4E prevention program reporting, child safety monitoring, workforce training and development, trauma-informed delivery system, CQI model fidelity of EVPs, equitable and culturally responsive services and supports, and then also making sure that you're coordinating with your local mental health plans, not only as part of cross-sector collaboration, but also when you're thinking about your contracting process for your EVPs and other services. Next slide, please. And then finally, the state has put out a template for the comprehensive prevention plan, which is not required. It's just a way to help you guide writing your plan. It's available on the CDSS FFPSA overview website, and the link was just dropped in the chat. This is a way for you to document the planning and pre-implementation activities of your FFPS program. The template represents both foundational and required components. And that is about all I have for a little bit of the level setting of the comprehensive prevention plan components, template, and assurances. And we'll pause for questions.
Great. So we'd love to hear from you. If you have specific questions about the components or the assurances or the CPP template. I know some people had submitted some questions that I think Hillary covered, but if you don't feel like it got covered, about what exactly they need to submit by July 31st. So if you have any lingering doubts about that or questions about that, please share. I also welcome folks to share if there's a component that they're having a particular challenge with, or a component that they feel particularly proud of that they've been working on. So I don't see anything in chat. You may have heard a lot of this information before, but just want to give folks an opportunity to either raise their hand or ask a question about in chat. Looks like Cindy's got her hand up. Thanks, Cindy. Go ahead.
Yeah, I feel like I'm kind of, excuse me, painting myself into a corner up here in Humboldt. I, used to work for the county, and I came back just to do FFPSA, and I'm really happy about that because of all the years that I volunteered with our CAPC, and we've always wanted to be able to have this. So it's like a dream come true. But my concern is around, because of course I'm short-termed and I'm going to be out of here, and I could use some advice or ideas around how I can transition the cross-system collaborative, which is the key piece in our CQI process, because we've got the cross-system collaborative meeting every month, and we also have the 20 sites meeting every month. And they have this roundabout way of being able to share problems and successes. They use PDSA to work out the kinks, but I want it to, it's not me, but the group that's come up with the plan wants that to live outside of county government, for lack of a better term. And I'm just kind of, and we're early on in the process, and I know we got 3 years, and in the plan itself, I'm alluding to the fact that the governance will, evolve, because the group, the cross-system collaborative, they've only been meeting since December. So they're kind of new to this whole thing, and they understand what they're supposed to do, but we haven't had any real big, ooh, my gosh, how are we going to fix that kind of things come up yet. But I'm wondering if anybody else has some ideas around how to maintain the sustainability. And I'm not talking about from a dollars perspective, I'm talking about programmatically of the cross-system collaborative as an independent agency outside of county government. And maybe it's the leadership team from AB 2083, because all those folks are actually there anyway because of the cross-system collaborative. So maybe that's it, and I just figured it out. I don't know. I'm seeing Cheryl nodding her head. I'm thinking, okay, well, it's got to be a good idea. I'll go with that.
You talked yourself right into the answer. That was the first thing I was suggesting, is that existing 2083 team would be where you would start, depending on how it's structured. And sort of when you talk about outside of the government agency too, though, I mean, that speaks of something maybe a little bit different. But I think you would start there and let it evolve. So.
Great. That's Cindy, that gets at that tricky piece of governance, right? Where you want it to be really community-based. And yeah, you need to have it be sustained in that. So the 2083 is a good place to look for that. A couple questions in the chat. And you can come off mute if you want to expand on them. But one was, when you say the spending plan is required, it seems additional clarification. Was it only expenditures for the state block grant is required? Can you clarify what's required in the spending plan? I don't know who wants to take that one from Kay.
The spending plan is, and correct me if I'm wrong, team, but it is to indicate to us you have an understanding or idea how you plan to spend, how you plan to use all the dollars that you have available to you. So it's not, it sort of gives us an indication, first of all, you've done that sort of fiscal inventory of all the resources that you have. And sort of has some idea where you might spend that money as part of this planning process. May not be totally solidified, but you have an idea.
Yeah, I think the idea was to talk about, for the services that you select and include in the CPP, that you have some idea about how you're going to use not only state block grant funds, but how you're going to match other funds to help support that. And, you know, we want to really encourage counties to think about external funding sources that are beyond the child welfare system, and how you can work with your cross collaborative partners to keep those funding strategies moving. And we know that they're not going to be stagnant over time, but I think we just want to see you know, your initial thoughts about how you think you're going to be able to do that over the 3-year period, and then some ideas about how you might sustain that beyond. And then one of the requirements that Hillary, it's a minor requirement, Hillary covered, is, you know, we want to hear also about the challenges and barriers to sustainability, something that we can think about and start to plan for over time.
You know, as you think about your strategy around the money, I mean, think about your short-term funding that's really like your, you know, time-limited funding versus some of your entitlement money that has a longer life. Just trying to like stage where you can spend money right away because of the time constraints, and setting up your infrastructure or setting up your community connections, just where you are in the development of those community relationships. How does any of that spending play into it, and can you use some of the short-term funding for that?
Great, Kay. I don't know if you want, if that answers your question. If you want to come off mute and ask any additional questions, please do. Please feel free to. I'm going to move on to Jennifer Cannell Pyle. Good to see you, Jennifer. Had the question, in submitting soon, what does it mean for the county to sign for assurances when California doesn't have an approved plan yet? So what are the implications of the, you know, pending, we hope soon, state plan being approved and the assurances? Do you want to expand on that at all, Jennifer?
Well, the county just wants, they feel like they might be committing to something they don't fully understand yet, because California doesn't have a plan, and how, you know, how does that guide the work going forward if it changes from the last draft that the county has seen.
Well, we set those assurances up for the very purpose of the fact that we didn't have a lot of detail in some areas like a CQI. You know, that those were to be determined as well. So we didn't want to slow and bog the plan down for areas that were still undeveloped and yet to be developed. It's just a commitment to understand that those when you sign those assurances that you will be prepared to commit to adjusting your plan if you need to. I mean, given that we haven't had our plan approved, I can tell you that it was not a lot of major substantive changes that would totally affect those assurances, at least from our perspective. So we're flexible enough that if you sign those assurances, that there are areas that are yet to be determined. And when we do, it's just asking that you commit to making those changes along with us. So that is the whole idea of the assurances, is not to back you into a corner, but at least to be aware of these areas that are important for the plan and for implementation. We don't have enough information at this point to put it in the plan, but we want your commitment to work with us to develop that later as it comes out.
I want to just add that the assurances gives you the opportunity to say that, it's simply that you're going to work with CDSS on whatever guidance comes out in the future. And through the governance structure process is built in that ability for us to engage you and get your input on what those processes would look like. And so we feel like it's again, nothing about you without you, right? We'll be creating processes and guidance that has your input and expertise and experience, so that it's not going to be, we don't expect it to be too far off from what you think you're all going to need as you start to implement the plans that you put into place.
Thank you.
Great, and it looks like Stephanie, I don't see the link, Stephanie, to the FAQs, but there is an FAQ document that will have lots of resources and answers to your question, to additional questions about the components and other areas. That will be, and we'll talk about resources later. There's lots of opportunities to get your questions answered, and you can both later in our forum today and also on an ongoing basis submit them to the CDSS inbox, and we'll give you that email address as well.
Hey, Barry,
Yep.
Barry, there was a question on the registration that I thought was an interesting one that I thought I would pose. Will counties be able to see the plans from CPP plans from other counties once they're approved? Will there be access to view approved plans? Have you guys thought about that at all? I know that the feds do it.
Yeah. And I don't see a problem with that. Of course, we would ask counties, permission to post, but I don't see. I think transparency is important, and it shouldn't be a secret about us all trying to move in the same direction.
Yeah, right. It creates sort of a community of practice and learning from one another and CQI. So that's why I wanted to put it out there. Mm-hmm. So thanks to whoever asked the question.
Great, and I see another question on there that I think Hillary clarified, that the CPP template is an option for you to submit according to that format. However, you're not required to use the CPP template. So I just wanted to reiterate that one that I think she covered.
But the assurances are required.
Okay, thank you. All right. So I don't see any additional questions in the chat. We will have additional time. If you think of one in this area, you can feel free to put it in the chat. We'll have some general time as well for Q&A at the end. But I want to move on to our next section of level setting. And this is a super important one that came up a lot in the word cloud, which is community engagement. And I know, because I kind of go way back with her, that community engagement is near and dear to Cheryl Treadwell. And so I'm going to hand it over to her to do some level setting in the area of community engagement.
Well, so this is, we started talking about this along the way today. So you have to have some key people at the table who are going to be impacted by your plan. What community groups do you have at the table? At a minimum, you got to have your child welfare agency, your probation, behavioral health, your local education folks, community-based providers, FRCs, the whole group of folks that we've been talking about tonight that I mean, this evening should be engaged in this planning and how they're going to be impacted. Identify who they are, and I would challenge you to think also about looking for stakeholders that you normally have not had at the table. I think that was something that we in our learning series about reimagining is like you want to have the usual folks, but at the same time, do you really, you know, and it really depends on where your community is with respect to this plan and with respect to, you know, the change and impact that you're trying to make in this area of prevention. But we've heard some of those engagement strategies early on in terms of, you know, the types of agencies that worked there before and using some different ones that bring people to the table. Be able to have that feedback loop, to be able to analyze the feedback you got, making sure that you're communicating that back. That is very important. Making sure that they understand how that how the feedback is either being used or not being used. Communicate those results. It's very important to have those ongoing feedback loops while you're doing this engagement process. I think that is something that as a state that we have learned the importance of engagement and telling people why you don't include things as well. You know, a lot of times we do the other, but we don't tell them why we don't include things. So it's important to do that. Monitoring, continuously monitoring and being able to evaluate your various engagement activities so that you can be able to identify where there needs to be improvements. And the process that you just have to have ongoing engagement with the community and with these entities. If that table is your 2083, you know, your governance structure, somewhere where they have to hold you accountable for how you're inviting your community to the table. Overall, what we want to see in the plan is that you have some demonstration of understanding the importance of engagement, that you have a plan for engagement, that those opinions matter, and you're not just putting things on paper to make us happy. You know, but it's your plan and you own it, and you should want that if you had to circulate this plan in the community, people could see themselves in it and say, yeah, we were part of that, we were engaged, we know where they're going with this plan. That may be challenging for some of the larger counties, but it's not doable. And then, you know, like counties like El Dorado, like you identified, I mean, it's just such a tremendous opportunity to go out and have a conversation with people. Once you realize you've done your assessment, it's like, hey, how about, even if it's the local mechanic, I mean, seriously, people these days have a lot of opinions about what goes on in their community. So I would encourage you to really take the engagement to heart and not just make it business as usual while you're doing this planning. And even if you don't have all that together, by the time you submit, you have some idea or some strategy on how you're going to do that. You can demonstrate that and write that in the plan, and then update it as it evolves. At least that's the way I see engagement being sort of manifested to us.
Thanks, Cheryl. Does anybody have any questions about stakeholder and community engagement? Lucy and Cindy were able to share some really powerful examples of how they are engaging non-traditional partners and really thinking about how to make sure engagement is happening with populations that might not otherwise be engaged due to language barriers. So if anybody has a question or wants to share briefly about a success or a challenge, we're happy to hear it now. Hearing and seeing none.
I will.
Oh, hi, Lucy.
Well, I just wanted to share an opportunity. This year, the community action agencies, also known as the CAP agencies in every county, there is a community action agency. They're required to complete a community needs assessment in regards to poverty and some of the impacts of poverty in the household for the families, the children. And so currently there is an opportunity for the CPP planning process to engage with community action agencies and share data because the community action agencies are required every 2 years to complete a very similar to the CPP. It's called the Community Action Plan, CAP, which includes a community needs assessment. And what you find is we can correlate poverty in our counties, and it could be data that can be utilized to support some of the activities and priorities that are being identified, especially around curriculum use, because you're going to see how some of the residents that are participating in this community needs assessment are indicating, obviously, childcare issues, obviously stress in the household. And so there's a correlation of data that can be utilized. So I just wanted to share with you, I'm currently, I'm working with our community action agencies to gather share the data so that we can utilize it in our plan. And I do have contacts throughout the state. So if you are supporting a specific county that Strategies is not currently supporting, please reach out. I can connect you to your community action agency and introduce you to their director or management so that you can actually work with them and they can share the data. So that's something that's my other hat. I'm a community action consultant as well. So I have the ability to do both, and I'm doing that for my county. So anyways, just wanted to share that as an opportunity.
Thank you. Thank you for the resource.
Yes.
Is that something you could put into the chat so folks could like how they contact or get engaged with their community action network?
Yes, I will put the website where you can go to the state. It is under the Community Services and Development Department, and it is a state. The state administers the community action agencies. We have 64 community action agencies throughout the state, and in their website, you'll be able to click on the county that you're working with, and it'll give you directly the link and the website to the community action agency in your county. One of the things I highly suggest, though, is to be aware that the data you're seeking is the community action plan data. And so just so that you know the lingo, and it is public information, but the beauty of community action agencies is that they're required to have town halls, surveys, different modalities that I think are great leveraging opportunities for us during CPP process.
Excellent. Thank you so much, Lucy.
I'm glad you brought
We do it in various languages too. Sorry.
Yeah, I'm glad you brought that up, Sydney, because I remember that back in the day, that was very that was a very popular resource, and I think people have forgotten about their community action agencies. And I believe there's some of the smaller counties that may have hinged a lot of their work to community action plans on the CalWorks side. So I'm glad you brought that up. I think that's an excellent resource for folks to consider.
Thank you.
Lucy.
And just wanted.
Lucy, we can't hear you right now, and so we're gonna move on to the next phase. And if there's more you want to share with us about the community action networks, we can do that in our Q&A section. Thank you. Cheryl. So next slide, and Cheryl, you were going to talk about tribal engagement.
I'm gonna say a little bit, and then I'll punt it to Kelly and see if they want to add. But I mean, we can't emphasize enough to have tribes at the table. They're sovereign entities, and that whole government to government relationship is real important to the tribes in terms of the respect that we give them around that. But they should be informed in every aspect of this planning as much as possible. And I think the more we learn from each other about what works best for engagement, we also are in conversation with our OTA folks to help with that. But it's important that in the plan that there's been some description that you've made an effort to invite and engage the tribe, either cross-sector collaboration or in the planning of some of the required CPP components. We just want to make sure that if there's opportunities for training, also opportunities for services that tribes can provide not only to their families, but maybe to the families also in county. So just can't say that enough. I don't know, Kelly, if you want to add any more detail to that.
Yeah, I'll just highlight a couple of the ways in which folks can really make sure that they're including their tribes. And I just add to what Cheryl said, CDSS really believes in the importance of engaging tribes in this process. And by way of that, really made that commitment, in the state's prevention plan. We did it in statute. And then we also try to infuse that in all of the guidance that we put out to you. And so if you take a look at All County Letter 2223, I'm sure you guys that's probably a dog-eared material for you at this point. But some of the ways that you can really think about how to engage folks, including what's been shared already, to request that feedback from tribes, is really focusing on the strengths and needs of the current prevention services and identifying where those gaps are that would fulfill the needs of their members. Try to be sure that you're including, when possible, tribes, and even just asking who needs to be at the table in that cross-sector collaborative team. Any opportunity to be a part of readiness assessments, asset mapping, any of the work that you're doing for the CPP development, inviting them to be an active participant at the table is really helpful. Particularly for those ongoing strategies, when you're thinking about your governance structure and your continuous quality improvement structure, making sure that you've got regular engagement to have them there and inviting them to be involved, because that can often bring a different perspective than what we see on a regular basis. In addition to that, really helping them to sometimes be the spokesperson of how to deliver services, especially when we start getting into the development of the prevention plan, engaging tribes and actively working with families while they're delivering services. When you're thinking about those aspects of your service delivery, where they really want to be helpful, especially in reference to the Indian Child Welfare Act and how to comply with that. They're vital at the table during that point. So just highlighting those ideas for you. And I know we have some questions, so I'm going to hand it back to, I think it's Barry.
I think it's actually Dana.
Yeah, it is I.
It is Dana.
Yeah, and I think we're actually on the next slide. So do folks have questions about engagement with tribes? There are some parts of the county where we have 4 tribes, where we have more tribes that are actively part of counties. So let me go to Cooper. You have your hand raised. Thank you.
Yeah, so there's this, I'm not sure this is a question yet,
Okay.
but I think there's a question in there. There's 2 scenarios. There's a scenario where a county has a tribal focus population that is the focus of the CPP, right? And then tribal engagement looks a particular way when that's the scenario. And then there's the scenario where the focal population, at least initially, is not a tribal population, right? Yet the tribes are still to be engaged at the governance level. And so I'm just wondering, and I don't know if it's a question it's probably a question for everyone, is how are those conversations going? We've got experience with, one county that has a focal tribal population and then one that doesn't. How is that showing up differently for people in terms of the engagement? Do folks have focal tribal populations?
Thanks, Kush.
Yeah.
Who wants to share their experience? Okay, let's see. A couple people have raised their hands. I don't see them, but I see, Cindy and Kush, I think you can
Yeah, I
lower
can
your
lower
hand.
mine. Yep.
Yeah,
There we go.
thanks. Thanks, Cindy.
I just wanted to speak a little bit to that. In our plan, we don't actually have our focus area is actually families at risk of abusing their children, which is not any of the 13 categories. But we did something really broad because of our situation up here in Humboldt, which is a little different. But that being said, we have a disproportionate number of Native American children in foster care and in probation. And so we did a lot of outreach to the tribes to have them at the table when we were doing the focus groups to find out, what do you need? What can we put into the plan that's going to help keep your families off of child welfare's radar? And I'm sorry that I don't speak consultantese because that's not really where I'm from, but and so they told us, they did their focus groups and they told us this is what we need. And so we've written those things into our plan for the next 3 years, and then looking at ways over time to be able to sustain that beyond, the state block grant and a lot of it. So we've written in, as an example, we wrote in I would call it an evidence-based practice. It's called the Road to Resiliency. It's not on anybody's radar. I don't even think it's that promising practice, but it's a combination between our first 5 and United Indian Health Services. And United Indian Health Services serves every Native American in Humboldt and Delaware County. So it's not specifically tribal to a tribe. Any California Native American can qualify for services. So we wrote that into our plan, not because we anticipate, well, it would be wonderful, 10 years from now, if that became a supported EBP and then they could do the Title IV claiming, but that wasn't the real motivation. The motivation was they have the program up and running now. Our 20 sites probably have families coming in who could qualify to be a part of that service. And then in the conversations with United Indian Health Services about keeping them in this or pulling them into this, and of course, they're part of the cross-system collaborative, we mentioned, oh, by the way, we're going to be doing motivational interviewing training for all of our sites. And would you guys be interested? And they said, yes. And so we're training all of their community health representatives in Road to Resiliency. So we're offering them something that it's time intensive, but that's their piece of it. And then they're getting something back and it's starting to grow. And they're looking at, ways to be able to do MI for like all of their community outreach staff to be able to have better outcomes. And that's kind of, I'm sorry, I feel like I'm kind of wandering off a road, but it was so important it was almost like an afterthought, but then it was like, this is the main reason. Yes, let's go ahead and do this. The other thing I wanted to mention too, is that I've been in conversations with Jessica Cannell Vaughn at the Yurok tribe. And they're sitting on, they have a seat on our cross system collaborative, even though they're doing their own plan. But she was just like, can we sit in on this? And I was like, you bet. Because I mean, what the heck? Why not? It's a good thing because that way we can, kind of know what each other's doing. And so we're not necessarily replicating services. In other words, she can be putting her money somewhere else while we're putting our money, quote unquote, towards, Road to Resiliency. Sorry. Okay, I'm done.
Thank you, Cindy. That's really helpful. I see Kush shaking her head, so I think she thinks it's helpful as well.
Yep.
And it's really important that not only are we having a conversation with our state partners, but we're having a conversation with one another to share strategies and best practices of what we're doing. So Kelly, you have the next slide, but I just want to make sure if there was anything on the slide that's showing now that you wanted to speak to, or we can move on to the next topic. You're good?
No, I think we can move on. Thanks.
Okay, so next slide, which is about selecting target populations, and Kelly. Thanks.
Okay, so So overall, as you're thinking about your target population, you're going to be working with the county to help them identify what this looks like. And I just want to clarify here, when we say target population, we're talking about the overall population that we think we're going to hear about when you say you want to provide services in the primary, secondary, and tertiary categories. It is bigger than your candidacy pool. So for example, as you're looking at the overall population, you're looking to identify of that, what do you want to prioritize? And so in order to determine that, you're thinking about things about, for example, you're looking at who's disproportionately represented in the, oh, Cheryl's calling me on the phone. Hang on one second. Sorry about that. So who's disproportionately represented in your child welfare system? Who in your community is more likely to be entering your foster care system? They may be thinking about what the outcomes of the social determinants of health in your community. What does economic stability look like? Where is that happening? Where might we want to see improvements for families in, health and mental health? Where might we want to be able to focus on building social connections? And all of that are factors that you want to be thinking about and looking at your total population and where you want to focus services. And then beyond that, you also need to be identifying where you plan to focus your Title IV-E eligible services, your EBPs. And there's no requirement that a county serve all candidates in the California's prevention plan all at once. In fact, it may be better to start with a smaller selection, expand over time in order to be able to do the requirements there, ensure model fidelity, and make sure your governance process and your CQI process is working as intended, and then grow capacity over time. And then at that point, you want to make sure you're planning for a needs assessment, identifying all the services that are already in place, what's not in place, where do those gaps exist, and then how can your CPP help to fulfill those gaps. And then, at the end of the day, when you submit your plan, you want to be thinking about the population that you want to serve, getting a sense of that number of recipients that you think you're going to be able to, and estimating that potential usage of services that you plan to offer. And this is really how you're going to be telling the story of the who and the how, and the outcomes that you think you're going to see when you get to your logic model and your theory of change, so that your plan actually can accomplish what you intended it to do. So again, starting with that broader population and thinking about the bigger picture, identifying your priorities, and then narrowing it down to those Title IV-E eligible candidates. And then just really calling out that you can serve both. You don't have to serve just a candidate for a Title IV-E eligible service. It's one piece of the puzzle, but really being able to clarify what those are and what services will meet their needs. And barring that little tiny phone call interruption, hopefully that was clear and if not, concise.
Thanks, Kelly. Any questions that people have about the target population or candidacy for Kelly and the CDSS team before we move on? There was one question or sort of a comment in the registration questions about small counties and rural counties, and any advice that any of you might have for rural counties in selecting their target population when they have a small rural population. So I don't know if the person who asked that question wants to come on, or if anybody on the call or CDSS has any guidance for the small rural population and target population.
Well, not hearing any shared suggestions or guidance or as questions, I guess. I will say that we know that there's a lot of counties who are struggling because they don't have either the need or the capacity for an EBP. And it's something that the state is thinking through and considering. In fact, we'll be launching some discussions in the near future to talk with smaller rural counties about how we can help support them in the development of a CPP where those challenges exist. And so if that's you and something that you're struggling with, look forward to hearing from us on that in the near future. And we're going to be partnering with CWDA to do that work as well. So something to think about there and keep in mind for the future. But if there are other questions that we can resolve in the meantime and you have them, or even if we can't resolve them and you have them, we can start to plan for those. So feel free to submit those as well.
Yes, thank you. And we're looking forward to that partnership, Kelly, to engage with the small counties at CWDA. So, you know, anything that comes to you after hours, you can send into the CDSS email address. And you can also, counties can reach out to me if they need to, if they have questions or concerns about that. So let's move on then. And Kelly's also going to talk a little bit about, and there was already a little bit of questions about this in the chat, about state block grant funding. So that's also Kelly's going to lead us through that conversation. So go for it, Kelly.
Okay, great. Thanks, Barry. So many of you are aware the state block grant for the Family First Prevention Services Program came about in the Budget Act of 2021. So this is a total of $222.4 million, and $199 million of that is available to counties as a state block grant to support the development and the administration of their comprehensive prevention plans. This is a short block grant. It's expected to be extended over 3 years. And the available time period is until June 30th of 2024. They're very flexible funds, and they can, I'll give you a couple of ideas about what they can cover. So this is something that you can use and provides 100% of funding for any FFPSA allowable service cost that is not able to be Title 40 eligible. So this is prior to automation. If there's something that you would be able to normally pull down Title 4E for, and that's not available yet, you can use the state block grant funds to do that. It can include administrative activities to support delivery of FFPSA services, again, prior to that Title 40 eligibility. It can also support any prevention activity that's not eligible under Title 4E, and that it isn't intended to be on an ongoing basis. So if you've got a service that's outside the federal prevention clearinghouse, that's something you can definitely use your block grant funds for. Allowable activities also include even just planning and developing your plan. I heard somebody talk about providing gift cards to bring in folks to participate in development. And that's something that you can do with community members, with voices of lived expertise, your tribal partners, that sort of thing. And then training your staff and contributing to that workforce, the professional workforce that's required in the federal law. All of that can be used for that in advance of those Title 4E prevention dollars. And this is really meant as a measure to support services while developing those long-term sustainability plans for prevention overall. One thing that's not covered under the state block grant, I mean, this is really intended to be used for prevention. So we wouldn't expect to see you using funds for families or children who are engaged in foster care. The child is in care, you know, that's not an allowable expense that we would want to see used. And then, you know, also for anything that's not included in the state's prevention plan, if you are interested in a promising or a supported activity, and we only include well-supported, state block grant can be used for that. But otherwise, you know, it's really, really flexible.
Great. And I know that Elizabeth Lee from Chapin Hall had a question, and some questions also came up in the registration questions about the timing of the state block grant funding and when they have to be expended by, and about that and sustainability. So Elizabeth, I don't know if you want to come off mute and ask your question about that.
Sure. Thank you for having us here this afternoon. I was elevating. There were a couple other folks that put specific questions in the chat that I think just got lost a little bit in the shuffle, but I think generally the questions are asking about the sustainability of the investment of state block grant funds and the potential drawdown for Title IV reimbursement based on the development of CARES. And of course, there were some other folks who may want to add clarity to their question as well.
And this is Jen O'Brien. I might just add that we were interested in learning if there's a consideration for extending the state block grant deadline, considering the CPP is being delayed in submission, and if that will provide counties a little bit longer to continue to utilize those funds while the CARES build continues. So just stating that same question, I think, Elizabeth, a little differently. Sorry, folks.
That's helpful, Jennifer. Thank you. And, this question comes up pretty frequently. There hasn't been a decision made on whether or not there will be any kind of reappropriation or ongoing funding in the California state budget. I know that that's been of interest. It's certainly of discussion, but at this point, we don't have any additional information to share about that, and likely not until we see more budget activity later on this year, this fiscal year.
And what about the extension of utilization of the block grant funds?
That's what I meant by
okay.
reappropriation. Yeah.
Okay.
Anything longer than 2024, we would have to get permission to have that reappropriated.
Okay.
Yeah, and one consideration that might be helpful for that is that's why it's important to get the plans in so that we can have some data to support an extension request, and not have people hesitate and say, well, if I'm not going to get an extension, I don't know if I want to submit or participate because I haven't started planning. No, I don't want you to get hung up on that. Get the plans in so we can start building some leverage for an extension request. Just sort of the way the legislature works, they have an appropriation cycle. They're not going to give us a crystal ball about that. But I think we have a chance, if we have some data, to tell them. Right now, we have nothing to tell them. We don't have plans. We don't know what counties are doing. That's the reason of this call, is to sort of gather what your challenges are and your thinking. And that's also to tell you, that's why you should have a multiple funding strategy for something like this comprehensive prevention plan. Comprehensive means that you can't put all your funding in all of your planning in one funding source. You got to have a multiple stream funding strategy for this, and thinking long-term when the drawdown the 4E funds is probably right when the system is going to be ready for that, because you have to think about this as a long-term mind shift. It's not something that happens in three years when you think about what you're trying to do from a prevention standpoint of it. So I would just encourage folks to, build really good plans around staging implementation and build it with multiple funding streams. That's why I would say spend all the short-term money first. You got multiple pots of short-term money, that you should probably spend as you move forward for the more longer term federal money that you're getting and drawing down the 4E. 4E is just a little pot of the whole picture. And that's what we keep having to remind people. It's just a small piece of the whole picture when you think about money. And then from the perspective of the monies that you get from OCAP, and those are ongoing community-based prevention funding streams. And so you will have opportunities to probably at some point rethink how you're spending that money. If you're spending it with community-based organizations, a lot of that money goes to community-based organizations. So it's just an opportunity to think multi-pronged on this and not let it be a barrier for submitting your plans. And this is why we're just trying to show you this array of different activities that may need to be staged. And it's not so much money that's needed right now as it is sort of setting up that structure for your delivery of services. And to be able to, and you can fund some of those services now. So hopefully that helps. And rallies your thinking about a multi-comprehensive approach to how to use those funds.
Thanks, Cheryl, and Kelly and team. I'm gonna move us along. We can certainly, we'll have another Q&A session at the end. But speaking of funding, everyone's favorite topic when it comes to Family First Prevention Services Act, the payer of last resort. Hillary is going to give us an update on some of the work group activity that's been happening and some of the work with DHCS that CDSS has been doing. So take it away, Hillary.
Thanks, Barry. I wish I could say I have all the answers, but I do not. But just a reminder that the payer of last resort is Title 40 funding. So it may not be used if another available funding source would have been used had FFPSA not been established. So as Barry mentioned, the first funding source that comes to mind is really Medi-Cal because it can fund substance use and mental health programs. So we have been working with DHCS for several months, probably over a year now. And what we've been doing is trying to think through which EBPs would be funded by Medi-Cal as a whole and which ones certain parts of that particular EBP would be funded by Medi-Cal. So we are actually walking through each well-supported EBP that is in our 5-year state prevention plan to determine which activities within those models can be billed by Medi-Cal. So the plan and the end of all of this work will be that we will be releasing joint guidance that can be used by local level comprehensive prevention plans in order to make decisions and figure out what payer of last resort will look like at their local level. And next slide, please. And so just a little update on the work group. So we started off with just having conversations with DHCS. And after speaking with DHCS, we realized that we needed to pull in local level providers as well as counties, as well as CWDA. So we formed a larger work group, and that larger work group gave us input on a couple of different deliverables. One was a decision tree to help us guide counties in determining the payer of last resort for the community pathway. Another was a glossary to help define terms that would be used in that decision tree. And then a list of frequently asked questions related to the payer of last resort. So after hearing from this larger work group, then DHCS and CDSS met for several months to come back with finalized documents to share with the larger work group again to get their input again. So at this point, we're back with the larger work group sharing those documents, and we should probably have about 3 sessions, and we started our first session last week. That work group will also help us with the matrix of the EBPs and which pieces are payable, or which parts of the EBP models are payable by Medi-Cal and which would be billed by 4E.
Thanks,
And
Hillary.
toss it back to Dana.
Yeah, thanks, Hillary. So Francesca LaRue had a question that I'm going to read for her. If behavioral partners are not fully on board, how do you suggest this be navigated?
I would say that they need to be on board. And if they're not on board, you could definitely reach out to us and we can help create that connection between behavioral health and child welfare at the local level to support that planning effort.
Yeah, I would also add that it sounds like if that's the case, then that's a larger problem that's even beyond FFPSA because of the cross-sector collaboration that's going on in other parts of our shop with Part 4 and some of the systems of care work where behavioral health has to be at the table. So if they're not at the table for this work, they must not be at the table for the other work either. So it's a larger conversation in terms of what is needed to make that happen. And so, yeah, as Hillary said, we would like to know that, but sounds like to me there if that's the case, then something's missing around that interaction for all the work that needs to be done in collaboration for our kids.
Yeah, That's right. It's not just about how things get paid. It's about how things are done and how things are planned for. Thanks for that, Hillary and Cheryl. Jen O'Brien had a question in the chat earlier on about payer of last resort. Jen, was your question answered, or do you have?
Yep, I think Hillary did it. Thank you so much, Dana.
Thank you. And then Yasmin, you put a note in chat. Did you want to come off of mute to just share?
Sure. I mean, just basically what I had said, that even if a service that is a Family First approved service is paid for by another funding stream like McPhee or Medi-Cal, there's still opportunities to be reimbursed for all of the administrative costs that go along with the case management if you have an identified candidate. So even if they get another service, you can still claim administrative costs. And my understanding from our experience in other jurisdictions is that's where you can maximize some of your funding in that way.
Right. Thank you, Yasmin. Hillary or Cheryl, did you want to make a comment about that before I go to Cindy, who had her hand raised?
No, I think that makes sense.
Great. Cindy.
I just wanted to state that early on, and it was actually a little too early on, I pulled together all of our fiscal analysts. We're what's known as a super agency, and a lot of counties are. And so we have public health and mental health and social services and child welfare and adult protective service. Everybody's all under one umbrella. And so I pulled all the fiscal analysts together from all the different branches and basically kind of told them, guess what? We're going to be going down this road, and I'm going to be asking you to help us work on creating sustainability for a lot of things that right now we can use the state block grant for, but it ain't going to be around forever. And so we really need to move forward. And we've added the fiscal analyst from probation. And then the County Office of Education has a huge prevention and intervention unit. And I met with them and they were hiring a fiscal analyst. And I said, it'd be really nice if your fiscal analyst would join our fiscal analyst and we could all have meetings. And you know, so right now it's like really at this little itty bitty sort of, I don't know what you want to call it, new phase, and they're really not, you know, working hard at it, which I wouldn't expect them to be, but I want them to start to get to know each other so that they can start having regular meetings later on down the road to be able to make this financially feasible. We've been doing braided funding here in Humboldt County for a bazillion years, and that's really great. And we also had CAPC. Our CAPC just allocated the Children's Trust Fund monies for the next 3 years to go to the community pathway partners. It's not a lot of money, but it's like, let's sort of demonstrate what we want to see happen over time, which can't happen until child welfare's workload drops down. But the reallocation of CB-CAP dollars, of PSSF dollars, and they already put all their CAPIT money out into the community, and that's really great. But, you know, as the need diminishes for the utilization of those dollars in-house, then of course they can start going back out to the community in some way, shape, or form through, you know, contracts and all that kind of stuff to be able to promote primary and secondary prevention. Sorry.
No, thanks, Cindy. I mean, I think it's really important that you're creating pathways for your fiscal folks to be communicating about how to sustain the types of programs for community, family, child well-being. So I think it's smart, and thank you for sharing that. Now I'm going to turn it to Kelly to talk about the CPP Review Tool. Kelly.
Thank you, Dana.
Next.
Thank you. So the CPP Review Tool is really intended, it's mostly an internal tool for our staff. Once they receive your plans, they're going to take this tool and use it as a guide for how they review and take note of the ways in which you have met the requirements for the plan. So really, this isn't anything for you to fill out, but it is something that in all transparency, we want you to be aware of what this process looks like. It's very straightforward, and you can see that Haley just posted the link in there, so you can take a look at it. And very straightforward information about, did you send in the information that we need to make sure that we've all met the requirements in both federal and state law. I'm not going to spend a lot of time reviewing it. It's super easy to review and read, and is really just meant as an extra tool for you all to be able to make sure that you met everything you needed to do for a quick and smooth review and approval. So that's available for you there. It requires those specific documents, so I'll just highlight them here. The assurances Hillary talked about earlier, the plan itself. If you use the template, include that, but that's optional. A spending plan is required, but you don't have to use the version that we created. And then anything else that you want to include that makes sure that you convey to us how you met those basic requirements. And then, of course, who you are, what your name is, and all of the ways to contact you. If there's, for some reason, something that may be missing, our team will reach out to the county contact to talk with them about how to reconcile whatever is missing. And if there's any technical assistance needed at that point, we'll be sure to work closely with the county to get things done expediently. So that's the basic of the review process. And if there are any questions, happy to talk with folks about it, but should be super simple and easy to follow.
Great. Kelly, I'll pause there and see if people have questions. Seems pretty straightforward, as Kelly said. So if people have questions, they can make them. But thank you, Kelly, for clarifying what the review process really looks like. I think that was a question that people had coming into the convening. And that's a great resource. Speaking of resources, I'm looking to see if there's any questions, and I don't see any. But we didn't really expect to have a lot of questions in that area. Speaking of resources, we're going to move on, and I'm going to briefly go over some of the resources that are available. There's a lot of resources available, and you've heard about them. And then we're going to have a chance to hear from you all about which resources have been most useful to you. So you can see up here on the slide, and in the chat, there's a clickable document that has links for all of these resources that we're talking about. And some of these resources have additional resources available to them, additional links to additional resources. So there's a really lot there. So you can find things that we've talked about today: the comprehensive prevention plan template, the assurances template is there, the local spending plan template that helps you to make that spending plan that we talked about a little bit today. The comprehensive prevention planning toolkit is on I believe it's on the CDSS website, and it's got a whole bunch of tools to help you with your CPP process. Kelly just talked about the CPP Review Tool that you can look at to see what CDSS is looking at and reviewing it. There's the prevention funding guide that helps, and we talked quite a bit about funding and the importance of having a wide array of funding available to you and planning to have different funding sources. So that prevention funding guide is going to help with that. The CPP implementation guide is something that Casey Family Programs and Informatics developed that really guides you through the process of the planning process. So I encourage you to take a look at that. It's got a ton of good resources. It's got some community, some communication resources and a communications toolkit embedded in it that's really good. I highly recommend you look at the data playbook for prevention action planning if you haven't already. It was developed by Safe and Sound up here in San Francisco, but it really is a great tool to really dive into your community data and sort it and analyze it. The folks at Caltrans who are supporting this also support the learning series that you've already heard about. Go to the Caltrans website. They have a resource page that's very comprehensive that has all of these resources and others on it. So you can click on that. And finally, if you do have request for support, there is a CPP request form that you can fill out. And then CDSS will respond to that. And I think the FAQs have also been in the chat already. So there's a lot of resources available to you. So why don't we go to the next slide and we'll hear from you a little bit. And then there's still, if you have questions about these resources, we're happy to have them. And then we're going to move to a general Q&A session. So if we could launch the poll, you can vote as many times as you like, folks. Which resources have been the most helpful to you, and choose all of them that apply. If there's another one that's not listed that's been super helpful, please share that in the chat, because we want everyone to have access to that resource that's been helpful to you. So you may need to scroll down. I'm hearing to see all the options, but there's a number of options. So why don't we have votes come in here? Looks like people are very grateful to get that review tool. The toolkit's very popular, pretty even. The learning series also has been very, very popular. So lots of useful things here. Well, thank you for that. And I want to now open it up. If anyone has questions on any of the resources that are available, we can close the poll down and open it up for any questions related to resources.
I would just like to say I really look forward to the rural county EBP implementation meetings, because the counties that I'm working in all across the board are challenged with incredibly small child welfare caseloads, which is a great thing, but it means there's not as much funding to see shift from kids in care to prevention, because they have such a small number of kids in care and are just really, really struggling with how they can do an EBP and really remain, model fidelity is a challenge. So I think that's just something we're really looking forward to. And what I've been saying to the counties is think about how you could create some kind of regional EBP implementation groups. But that's going to be something challenging that will really need help from CDSS in implementing.
Yeah, thanks for that comment. And as Kelly said, we're CWDA and CDSS are planning on partnering to do those convenings and have that conversation. We're looking forward to it. And I will, seeing no questions on the resources, we can open it up and Dana can come back into the picture, and we can facilitate just any other comments or questions that you all have related to comprehensive prevention planning.
Yeah, I invite folks to raise their hand, drop questions in the chat. This is really an opportunity for the broader dialogue, right? That July 31 is coming upon us. And I know you all are busy at work with your counties to develop a plan. And so the CDSS team is here to help. And I think the cross-county, cross-consultant dialogue is also really important. So I just want to invite folks to ask their questions. What didn't we get to that you'd like to hear more about? Are are there some experiences you're having in the counties that you think would be good for your colleagues to hear about? Thanks for joining us, Yasmin. No questions? Nothing that you want to share with your colleagues?
This has been really great. Thank you.
I actually had a question since you asked, Dana.
Yeah.
I know that the state is engaged in some movement around mandatory reporting and changing that to mandatory supporting. And I was just wondering if there were any updates on that, because I see that as integrally linked to Family First and prevention. And I'm just wondering what the vision was, and if you could share anything more than what I've already seen in terms of the Safe and Sound report.
Go ahead,
You want
Sharon.
to start answering that, and
Sure.
then you can add to it, you know.
Sure. The Child Welfare Council has a prevention and early intervention committee that has been working over time to develop recommendation to the Child Welfare Council related to Families First. And so part of that process has been, we came to a point of thinking about the community pathway and how to really build out a community pathway that encompasses the full continuum. And part of that continuum really starts with keeping kids out of care, right? And so other efforts were happening at the state as well. The Citizens Review Panel, their prevention panel, made some recommendations to the state to create a mandated supporter task force. And the CRP and PEI came together, and those recommendations were included in the community pathway recommendations to the Child Welfare Council, which was unanimously approved on the 13th, and we're really excited about that. So the recommendations will happen in the context, the task force recommendations and the work of the task force will happen in the context of the broader PEI community pathway recommendations, but it will include the, the recommendations from Safe and Sound, the recommendations from the CRP. And right now we're really trying to put some infrastructure together to support the development of that task force to begin in July. So there's not a lot of update, but I think Hillary and Cheryl will, I'm sure, say that, right, like having a robust community pathway can only help us keep kids and families and communities well. And so supporting an alternative to reporting to child welfare is really what our focus will be. And I think FFPSA has really provided, and the state plan has provided a pathway, if you will, to do that. So we're really excited. Thanks for asking the question.
Thank you.
Hillary and Cheryl, did you want to add anything?
Cheryl, you want me to go first?
Yeah, go ahead, Hillary. Yeah, go ahead.
Okay. I would just say some of the next steps that we have started on is we are reviewing the OCAP funded mandated reporter training, and we're going to be making revisions to that. And we started with gathering feedback from the child abuse prevention councils, but we're also going to be holding additional focus groups to gather feedback from a broader array of stakeholders to come to an agreement on what this new mandated reporter training should look like. In addition to that, we'll be developing a work plan on how we're going to be responding to all the recommendations from the PEI. And we will be doing that in alignment with the task force and the CRP and all the other entities that are going to be working on this amazing, exciting, monumental shift.
Yeah, I can only add more of a sort of encouragement to counties to see this as opportunity to really do true prevention, and also attached to the work is, there's a racial reality to child welfare and prevention and poverty, and the intersection of all of those things, an opportunity to really have a great community response to that. With child welfare not necessarily being the lead, but as there are community folks that are able to do that work and do it together and build that kind of network is what we would like to see, where you don't have a need for a child welfare system. That's the vision. If you have that vision and that trajectory of thinking, then that's really what the true mind shift of even the mandatory reporting brings you to is, and I don't know if y'all discussed this earlier, but the main focus of a lot of this work is around the whole racial reality of the American Indian and Black children in this system, those families. And if you're not asking those questions through that lens when building this plan, then that is something that you need to be attuned to. So just wanted to make those points as well. So it is exciting. So I'm, Cindy, when I see you, just sort of reminds me of the early work that was done in Humboldt around that concept and around EVPs and doing a lot of the community work. So it was good to hear you speak to those elements on this call today.
Thank you, Cheryl. And I just wanted to say too that one of the things that I was reminded of recently when I was talking to Dr. Kushka Riesling-Baldi, who is the department chair of Native Studies up at Cal Poly Humboldt, is if you speak it enough, it will become. And so you have to say the vision. You have to say it over and over again. And things do change.
Thanks for that. We have a question in the chat from Maria Chesley. Maria, do you want to come off mute and ask your question? I know it was also a question you asked in the registration as well.
Great. I was just wondering if anyone has created a comparison of their differential response or front porch program and a comparison of that to community pathway. We're just thinking about how to evolve those similar systems in our county, and just wondering if we could learn from any of you all.
All right, thank you, Maria. Is there anybody out there that's been really considering the differential response? I think it's excellent because you're right. It is a similar approach to the community pathway, and how you think about evolving it is really critical.
So in Calaveras County, we haven't done a comparison, but they started a differential response program about a year ago. And now we looked at, that Chapin Hall guidance on community pathway questions, and, sat down as the team, the Family Wellness Coalition, and went through some of the questions and thought about, what would be the difference between a differential response program and a community pathway. And most simply, hopefully in a community pathway, you never have to be, right now, the DR program, the people they have to have an allegation. Mm-hmm. So they, there may not be any investigation or whatever, but that's how they enter the system, and then they're diverted. So what we talked about is the community pathway being way further down, so that never has to have an allegation, but rather there's these places available that are trusted. And we just talked a lot about how the DR program, about half the people, and it's a small county with small numbers, but like half of the folks never that are referred to the DR program, they don't take advantage of them. And it's voluntary, they don't have to. So we really were thinking about, how do you address that group, plus opening it up to really any family that has an issue or concern or needs support and just wants some connection with community agencies. So we use that Chapin Hall document as a way to kind of organize a conversation around that, if that's of any assistance.
Thanks, Barb. And it sounds as if Sarah from Strategies has also been having that conversation with the counties that she's working with. Maria, if you want to access that document, you can go to Chapin Hall. Is it .org, Yasmin?
Yes,
I think it's right in the, I think it's in the chat, right?
Is it
Community
already?
pathways, considerations and guiding questions. Yeah.
Great.
It's great.
Yeah.
Yeah,
Good.
we're using that too. Thanks. It is very helpful.
Good. So we are at time. We want to thank you all for joining us today, for your questions, for your engagement, for your thoughtfulness, and for your support to the counties where you're working. I know they appreciate it. We're looking, please feel free to, we gave you resources to reach out to CDSS. And I think Cheryl would say that this is not a one and done, but hopefully we will be able to come back again together as things progress. So thank you all very much.
Yeah, and I would add, you know, we hope we were able to alleviate any of your doubts or your fears or even myths that are out there. And as Dana said, this is a dialogue continuing. And so appreciate you showing up in this space and sharing and being transparent with the work. So just having this conversation gives us hope that good things are happening out there in the counties. So thank you once again for your participation.